Tēnā koutou katoa. Thank you very much for attending today's briefing on Easter Sunday, and really appreciate your ongoing support and interest. So today we have 18 new cases of COVID-19 to report. This comprises 14 new confirmed cases and 4 probable cases. There are no additional deaths to report, so the total number of deaths remains at 4. There are now 471 reported cases of COVID-19 where the people have recovered from their infection. This is an increase of 49 on yesterday. As you will see then, we continue to report more recovered cases than we do new cases. The new total of combined and probable cases in New Zealand is 1,330. Today there are 14 people in hospital, 1 each in Wellington, Middlemore, Wairau in Blenheim, Dunedin and North Shore hospitals. 1 of these patients in ICU, of the total of 5 in ICU, are in a critical condition. So the 14 people in hospital, 5 in ICU, 1 of whom is in a critical condition in Dunedin. For the cases we have information on, the strongest link is with those who are contacts of existing cases, that's 47%, while 40% are linked to overseas travel. 2% are confirmed as community transmission, while 11% are still under investigation. That's a reduction from 18% a week ago. In terms of testing yesterday, it was a quieter day, I think reflecting the Easter break, and 2,421 tests were processed. The 7-day rolling average is now 3,523, and the total number of tests undertaken is 61,167, and we will of course include those updated figures on our website. Just want to comment on aged residential care as a key setting. We currently have 3 significant COVID-19 clusters in aged residential care facilities. 2 are in Christchurch and 1 in the Waikato. Now we know from international reports and of course our experience here with the 3 deaths over the last 3 days, sadly, that this is a group that is particularly vulnerable to a poor outcome if they do get infected with this virus. We are prioritising a range of actions around this, and the DHBs and the Ministry have worked very closely with aged residential care providers and their umbrella groups right since early on in this outbreak. Very early on in the piece, I sent a message to aged residential care facilities, even before we had very many cases in New Zealand, to prevent anyone coming in, both staff and visitors, who may have any symptoms of a respiratory illness. And likewise, very soon after that, we advised them to restrict visitors. In fact, stop any visitors other than those that were for compassionate reasons. Yesterday, to supplement this, I wrote to all District Health Board Chief Executives again, asking them to systematically assess the readiness of all aged residential care providers in their area and to provide support and assistance as necessary. So the DHBs will look at each facility's plans and procedures to ensure that they are reducing any risk to residents and staff, and this will include assessing PPE stocks, how it is being used, and also to ensure that there is a ready supply of PPE for those facilities. We've produced very clear guidance and updated that yesterday on the measures that these facilities need to have in place to protect staff and residents. And most important here, of course, is that any staff who are unwell, even with any mild symptoms, or who have maybe a close contact of an existing or probable case, do not come to work. And the units must have in place very clear policies and procedures for how they treat any possible or suspected cases. So there are a number of steps underway to continue to work very closely with our aged residential care sector to ensure that we are keeping both the residents and, of course, staff safe there. In terms of the Rosewood residents who are currently at Burwood Hospital, there was a question asked yesterday about this, and in particular why they're not treated as hospital admissions. So the Rosewood residents were transferred to Burwood last week from what we would call a high-level psychogeriatric or dementia care unit. The care they are receiving is consistent with that high level of care they would have received if they had remained at Rosewood, and includes, where appropriate, end-of-life and palliative care. It's true that they are indeed now in Burwood being cared for by DHB nursing, healthcare assistants and other staff, but as would occur in the unit that they came from, the medical care is overseen by the GP even while they are in Burwood. So the care that is being provided is not medical care per se, just because they happen to be in a hospital setting. It is the care and support they were receiving when they were at Rosewood. Just an update on clusters. We continue to keep a very close eye on our 13 current clusters, and we recognise the significant public interest in the management of them. Just some clarity around one of the clusters yesterday that was named as being related to Spectrum Care, and I know there has been concern from people who receive services from Spectrum Care, and I want to reassure you that there is no need for concern there. The current cluster has 28 confirmed or probable cases, and as the Director of Public Health, Caroline McElnay, mentioned yesterday, these originated in the community and subsequently led to an infection of a person linked to Spectrum Care. However, it's not a cluster that had its origin within the Spectrum Care facility. A small number of the cases, though, are related to that, to Spectrum Care and worked there, in this case 5. All the positive results attributed to this cluster are other cases are in the community and include household and other close contacts. And I can say that the Spectrum Care staff have followed all appropriate actions, including self-isolating staff while they recover, and are working closely with the public health unit up there, Auckland Regional Public Health. And a couple of comments to finish on, and I've said this each day for the last week. It's very important people seek timely care for their healthcare needs. We have seen, and you've seen, stories of a drop-off in emergency department presentations. And I've just had the latest report from Healthline showing that many people who are calling have got quite serious symptoms when they do call. People should not be either afraid of seeking care, nor should they delay doing that. Emergency departments, doctors' surgeries, after-hours facilities all have in place very clear processes to separate out people who might have respiratory symptoms and might be being investigated or subsequently investigated for suspected COVID-19 from others who are seeking other care for other conditions. So people should not delay seeking care. They should ring Healthline, get advice. They should ring their regular GP. And likewise, anybody who has respiratory symptoms and feels they need or should be getting a test should seek advice either through Healthline or through calling their own GP, and they will be given advice about where to get swabbing done at their local community-based assessment centre. Finally, a message around Easter. As I said earlier, and as you will all know, it's Easter Sunday, so think particularly about older friends and whānau. We know Easter can be a hard time for a lot of people who may not be around friends or family at a time when we are usually very close to our friends and family. So if you can this Easter Sunday, do reach out across the generations, call or virtualise your messages to family and friends. I know many people will be doing that, and I thank you and encourage you to do that. This is a collective effort, and we will get through this if we continue to support each other.